Welcome to all. Today I am going to discuss about the efficiency of memory specificity training MST in reducing the symptom of obsessive compulsive disorder. This is a thesis proposal, thesis submission. This is submitted by me, Raju, MPhil student, Department of Education and Counselling Psychology, University of Dhaka. So today I am going to discuss about the content. Here is the content and timeline of the research. The first enrollment was started 5th September 2022 and first seminar was 13 February 2023. First year final 21st January 2024. Training and date collection 6 July 2024 to 14 September 2024. And data analysis 5th October 2024 to 24th February 2025. So write up the thesis was 1st March 2024 to 25th May 2025. Pre-submission seminar to 20th May 2025. So to discuss the whole process, I will use English and Bangla language that can be comfortable with me if you permit. So OCD, obsessive compulsive disorder. OCD is called the recurrent intrusive unwanted thoughts, feeling and behavior. The intrusive thought means the thought that the person don't want to go inside his head, but it recurrently and persistently go in his or her brain. So this is the two condition, obsession and compulsion. Both are important because OCD implies the obsession and compulsion. Obsession means the intense persistent thought or image, and compulsion urge to carry out an act or rituals. So if I take an example, suppose someone might be obsessed fears of germs or dirt. When a person feel this way, he or she can do compulsive behavior like washing hands 100 times. So aims of the study, the general objective was to explore the efficacy of the memory specificity training MeST in reducing the symptom of obsessive compulsive disorder among Bangladeshi adults. The specific objectives was to examine if there is any significant effect of MeST in reducing the symptom of obsessive compulsive disorder. The second specific objective was to examine if there is any significant effect of MeST in reducing the depression, stress and anxiety. Third one, to examine if there is any significant effect of MeST enhancing the life satisfaction of the participants. How to enhance current treatment alongside traditional intervention for Bangladeshi OCD patient participants. So the next on the prevalence of OCD in worldwide. OCD is the 10th leading cause of disability worldwide. For women aged 15 to 44, OCD is the 5th leading cause of disability. In worldwide, estimated rate that 1.1% to 1.8%. You can see in my slide. United States 1.2%. And China it is 1.63%. Prevalence of India it is 0.6%, and Pakistan estimated prevalence around 3%. Nepal shows the comorbidity on 63%, and they show that OCD patient had list on other psychotic disorder. Sri Lanka it is 1.73%. These all are the recent research. You can see the first on India 2060, and Pakistan it is 2021, and Nepal it is 2020, 2070 Sri Lanka. So prevalence of OCD in Bangladesh it is we can see the National Mental Health Survey 2018 to 2019 Hossain et al 2022. They shows among adults aged 18 to 99 years is 0.7%. Among children and adolescent aged it is 7 to 17 years is 2%. A study of Chaudhary et al 2016, they also see the 2% prevalence among the children adolescent aged 5 to 18 years. and they shows the comorbidity present in 58% in cases. OPD of basic memo between the May 2015 and April 2017 analyzed 400 patients diagnosed with OCD. The majority of the patients, 45%, 45.5% are in the 20 on to 30 years group, with the male predominance 58.8%. Available treatment, basically there are two type of treatment: medication and psychotherapy. In medication there are SSRIs, and psychotherapy, especially cognitive behavior therapy, is applied, especially exposure and response prevention, ERP therapy. Limitation of ERP therapy and mitigation of strategy. The phase of limitation: there are lack of trained professional, high cost of therapy, scheduling, time and commitment, stigma and awareness, cultural misalignment. And mitigation strategy: local training and task shifting, slide scale and clinical group, digital tools, flexibility scheduling, brief ERP protocol, family support, education campaigns, community involvement, normalizing mental health, cultural adapted intervention, local clinician input. So how MeST overcome challenge of ERP in Bangladesh? In the phase of trained professional, MeST and challenge in ERP, if we differentiate, we can see simple and manualized, easy to train, non-specialist, cost effective, fewer resource, group self-help formats, very flexible, can be integrated to existing treatments, focus on memory, thinking skill, less stigmatization, user personal experience, culturally adaptive, enhance emotional connection, key in OCD, boost cognitive flexibility and future thinking, complements ERP or CBT without replacing them. This is Memory Specificity Training, MeST, adapted by Elijah Werner and team, translated by Susan Squeezer, from the manual created by the Race Williams et al. 2009. In this case, I want to share that it was mainly first created by Race, and it was in Dutch language. Bangla translator, I'm the Ashutosh Raju, M.Phil Research Fellow, Department of Education and Counselling Psychology, University of Dhaka. This research translated the manual into Bangla, then on Bangla language expert and on English language expert reviewed and compared to the translated text with an original English manual. So memory specificity training is one of type of cognitive behavior therapy. Improves individuals' ability to recall specific past experience through the repetitive memory retrieval practice. Leading is better emotional regulation and reduce the psychopathology of symptom. Here main thing, that is a specific autobiographical memory, refers a personal memory of a single event that took place on a specific day or at a specific moment. How it works? It breaks cognitive avoidance, contextualization, future thinking, cognitive flexibility. Keyword: success. If we prompt them, recall a specific event even when experience success. I feel successful whenever I do well at school. This is overgeneral memory. When they can specific: last Tuesday I got the highest grade in my biology class and my teacher praised me to front of everyone. So memory specificity training, MeST, especially it was designed for the intervention, that is to improve autobiographical memory specificity, Williams et al. 2007. Target issue was reduce the overgeneral memory, recall cognitive pattern linked to emotional disorders such as depression, post-traumatic stress disorder. And overgeneral memories impairs access to specific personal memories, which affect problem solving, emotional regulation. The research evidence shows that increased memory specificity reduces psychological symptoms, enhances cognitive control and emotional processing. Research gap: predominant study Western population, limited evidence from non-Western contexts such as Bangladesh. Cultural and clinical factors may influence outcomes. The MeST procedure 5 weekly and on 20 minutes group session. Aims are session 1, session 2, session 3, session 4 and session 5. This is the MeST activity and homework. First session was introduction, and second positive memories and activity, negative memories activity, neutral memories, and fifth session review of integration activity. There are few homeworks and 10 negative keywords also. According to manual, there are one specific memory for each 10 negative keywords as a homework. So literature review for MeST in treating OCD. This is also used MeST for autobiographical memory. Autobiographical memory has increased the treating the depression or emotional disorder. It reduced the autobiographical memory specificity and modifiable. It linked to the symptom of reduction. Hitchcock et al. 2070 and et al. Capture and rumination, functional avoidance, impaired executive control, memory specificity training, MeST. Targets to define the may benefit OCD, improving memory, access, cognitive flexibility, raised 2009. And current limitation, no published clinical trials to date have tested MeST specifically for the OCD. Evidence is indirect based on the overlapping cognitive mechanism with MDD and PTSD. The research question: does MeST significantly reduce the symptom of OCD among Bangladeshi adults? To what extent does MeST reduce a specific OCD symptom? Does participant in MeST improve overall life satisfaction in individual diagnosis with OCD? So rationale of the study: MeST is a new therapeutic method aimed to improving memory specificity, originally used for depression and PTSD but not yet tested for the OCD. OCD involves overgeneral thinking, which MeST directly targets. No studies on MeST effectiveness in the Bangladeshi context. This research explores if MeST can reduce the OCD symptom and improve life satisfaction. If effective, MeST could become a valuable addition to extending treatment in Bangladesh. The method: research type, quasi-experimental design, pre-test, post-test, non-randomized, single group. Variables: there are two variables, independent variable, memory specificity training, dependent variable, severity of OCD, symptom, depression, anxiety, stress, and life satisfaction score. Data type: the data collection process involves primary source of data. So study location: the study was conducted in the training room of Education and Counselling Psychology, University of Dhaka. The sample included adult individual diagnosis with OCD, depression, and anxiety, stress. Participant sample was through a purposive sampling method. 14 clients from the OPD, Bangladesh adult diagnosis with OCD. Diagnosis by the registered psychiatrist based on DSM-5, adult 18 years and above, do not had other comorbid disorder, do not had major physical illness, had proper cognitive insight based on DSM-5 mental status examination, do not had major disability. There are 57 individuals contacted mostly OCD, 32 registered, 19 attend first session, and 40 completed all 5 sessions. Research design: this is the research design. There was pre-training assessment, then training session 3, training session assessment. After that, training session 4 and 5, and post-training assessment. This is the training plan. First, introduction and basics are given. Then session 2, 3, and 4 was the homework and the practice session. Here the positive or neutral, or positive and neutral, all cues and overgeneralization in session 4. And the 5th session, review and reflection. Instrument: demographic and personal information. There was age, gender, educational age of onset, and duration of illness. Psychometric tools: the Dhaka University Obsessive Compulsive Scale, Mojumdar et al. 2070. The Bangla version of the Satisfaction with Life Scale, Ilias QSM 2011. The 21 item Bangla Depression, Anxiety, Stress Scale, Alim et al. 2070. And intervention was according to Manual of Memory Specificity Training, MeST. Procedure of the study: the preliminary test was taken. It was conducted with 10 participants. These participants are not part of the final intervention. Evaluation: ability to retrieve specific autobiographical memories using cue from the MeST manual. To evaluate the feasibility of the memory retrieval exercise before full implementation. The main research starting inform the important context of the study, signed informed consent, and second step, demographic information diagnosis by the psychometric tool. The third step, the intervention step, 5 weekly session on 20 minutes, a small group of 14 participants, and the assessment, it was pre-assessment, assessment after 3 training session, and post assessment. Statistical analysis, there are Wilcoxon ranked test, descriptive statistic normative test by using Wilcoxon side rank test was used because this was the non-parametric test and compared the same group before and after intervention. Also the compare the Wilcoxon works well non-normally distributed interval data. Wilcoxon is more reliable with a small sample. Preliminary findings and implication for the main study: OCD individuals showed impaired memory specificity. MeST improved memory with repeated practice. Initial difficulties led to study design adjustment. Structure, training, and guidance are added. Cues and step-by-step support enhanced recall. Demography and clinical characteristics of participants. There are variables: gender, age, birth place, marital status, education status. Here I can see we can see male and female. Among the male and female was more. Demographic and clinical characteristic of participant. Number 14. Socioeconomic status, taking treatment or not, duration of treatment, type of treatment, all are included here. The summary of the normative test using Wilcoxon sign rank test is given here. Mean SD and Coleman group similar p value. Result: Wilcoxon side rank compare pre-test and post-test score, OCD, depression, anxiety state, life satisfaction. We can see OCD, it is according to pre and post-test, it is significant. Depression, it is also significant. Anxiety, it is not non-significant. Stress, significant. Life satisfaction, non-significant. So if we compare the mean score pre and post intervention, we can see the PD test, it was 39.3% and it was reduced 25.9, 14.2 to 10.6, 11.6 to 9.7, and 16.4 to 8.7, and the life satisfaction increases 3.9 to 17.6. If we in discussion, we can see the OCD, depression, or stress symptoms according to support of MeST is reduced, and large to moderate effect size confirm practical and real life impact. Missed outcomes: no significant changes in anxiety and life satisfaction. Adding more participants may show the broader emotional impact. Life satisfaction is improving and could get even better with some more further refinement. Intervention design insight: initial struggle with memory retrieval inform the additional structure, training, and guided example. Reinforcement are very important. Preparatory session, participant diversity. If we missed linear purpose may have influenced variability in outcomes. Subgroups of different disorder analysis recommended for the deeper insight into MeST's different effectiveness. Future direction: adapt MeST to better target anxiety and life satisfaction. Consider long-term follow-up to assess the sustained impact. So these all are the key reference, and thank you.